Hello, dear student. This is the second part of the child abuse lecture. Um, these are the goals of our lecture. We have mentioned the first, second, and we started in the third goal, which are what are the different types of child abuse. We have mentioned the different types of child abuse, and we have mentioned that the physical abuse constitute or contain different types of or different forms of lesions. We discussed the first type of lesion, which is the skin lesion. Now we will discuss the second type, which is the skeletal lesions. As regards the second type of lesions present in child abuse, these are the skeletal lesions. Skeletal lesions means fractures. Fractures are either fresh or healed. Fresh fracture, example of fresh fracture is the spiral fracture of long bone. Spiral fracture of long bone. This is a very suggestive sign of child abuse as it occurs only by twisting the limb. It doesn't occur due to fall on the limb or due to blow to the limb, but it occurs due to twisting of the limb. So this leads to spiral fracture, and this spiral fracture is suggestive or significant for a child abuse. The second example of fresh fracture is fracture rib angle. This occurs due to compression by an adult hand on the chest or cage of a child. This compression may be anteroposterior compression, and this will lead to fracture of the rib at the mid-axillary line, the angle of the rib at the mid-axillary line. Sometimes the compression is vertical compression, and this will lead to fracture of the rib at the posterior part of the ribs near the paravertebral gutter or in the paravertebral gutter. Sometimes the fracture are healed or the just evidence of healed skeletal injuries. This evidence in the form of callus formation. What is callus formation? It is the type of bone healing, or the shape of bone healing is known as callus formation. This occur at the area of previous fracture. When the previous fracture heals, it will lead to formation of a callus, which is shown at the tip of the red yellow arrows here. You can see that there is some expanded part of the bone. This is known as the callus formation. The second evidence of old healed skeletal injuries is subperiosteal calcification in old hematoma. Sometimes, in case of injury of one limb, there will be old hematoma under the periosteum of the bone of the child. This hematoma may undergo calcification, so you will see a shadow of calcification around the shadow of the long bone, which is normally present on the X-ray. The third evidence is chipped epiphysis near large joints such as elbow or knee. This is known as the coronal fracture, occur at the corner of the long bone inside the joints of the elbow or knee. This is the coronal fracture, and sometimes it is more broader and lead to metaphyseal damage. This metaphyseal damage occur at the ends of the long bone in the elbow or knee joint, and it leads to what is known, or the radiological sign known as a bucket handle appearance, which can you see in the picture here, the bucket handle appearance. The fifth type of skeletal or evidence of healed skeletal fracture is classical radiological sign. This classical radiological sign is known as the string of beads appearance. This occurs due to multiple callus formation on the ribs in the vertebral gutters. And as we said before, this occurs due to squeezing or compression of the chest cage of the child by an adult hand. This, this is the string of bead appearance radiological sign, and this is a classical radiological sign of so we have finished the skin lesion and the bone lesion or skeletal lesion. What next? We will discuss head injuries. Head injuries is the most common cause of death in child abuse. Actually, the most common type of injuries or the most common injuries occur in child abuse are the injuries in the skin, then the injuries in the skeleton. But the most common cause of death in child abuse is head injury. What are the head injuries which can be found in child abuse? If we go from outside to inside, we can find scalp hematoma. This is hematoma in the outer layer of the skull or the head, which is the scalp outside the skull bone. Scalp hematoma. Then the second layer is the skull, which is the bone. We will have skull fracture. This fracture is commonly in the form of fissure fracture. This fissure fracture commonly occur in the parietal or temporal bone. Rarely it can occur, or less often it can occur in the occipital or frontal bone because they are harder or thicker. And these fissure fracture are uncommon at the base of the skull. If we leave the skull and go deeper, a layer deeper, we will find the meninges and we will find subdural hematoma or meningeal hemorrhage in the form of subdural hematoma. This hematoma may arise from either direct impact to the skull or from vigorous shaking. Vigorous shaking lead to shearing stress on the cranial contents, and this will lead to rupture of the bridging vein in the subdural space and leads to subdural hematoma. If we go deeper, a layer deeper, we will find the brain. The brain may show cerebral edema or diffuse axonal injuries. So the head injuries in the case of child abuse may be scalp hematoma, fissure fracture in the skull, subdural hematoma, cerebral edema, or diffuse axonal injury. Next, we will discuss visceral injuries. We have discussed skin lesions, skeletal lesions, head injuries, and we will now discuss visceral injuries. Visceral injuries is the second most common cause of death. Second most common cause of death in case of child abuse. These injuries occur because of the thin abdominal wall of the children. If someone give a child a blow in front of his abdomen, this may lead to injury inside the abdomen. The injury may include intestine because the duodenum and jejunum can be sandwiched between the blow on the anterior abdominal wall and between the spine, lumbar spine. So it may the jejunum and duodenum can be crushed or even clearly transected, and this may lead to consequent occurrence of peritonitis and shock. In this picture, you can see the crushing of the loops of intestine. As we said, this occur because of the thin wall of the the thin anterior abdominal wall of the children and infant. So a blow to the anterior abdominal wall will sandwich the intestine or intestinal loops between the blow outside and the lumbar spine inside and lead to crushing of the loops of intestine. Sometimes it may lead to clear transection, and this will lead to consequently lead to peritonitis and septic shock. To the abdomen lead to laceration in the mesentery, and this laceration in the mesentery may lead to intraperitoneal bleeding, and sometimes blow to the anterior abdominal wall may lead to rupture of the liver rupture of the liver, as can seen in this picture. There is several laceration of the anterior surface of the liver. This may occur because of a blow to the anterior abdominal wall, or sometimes just the prodding of the adult hand on the liver may lead to this rupture or laceration in the liver. Sometimes by the same mechanism, the spleen is affected by rupture, but this is rare because of the shelter position of the spleen under the thoracic cage. Then we will discuss eye and mouth injuries. Eye injuries occur in 70% of infants exposed to child abuse. It occurs either from violent shaking or from impact on the injuries to the eye include dislocated lens. The lens will dislocate from its side and be free in the chambers of the eye. Vitreous hemorrhage, this is vitreous hemorrhage, and sometimes detached retina, the retina detached from the posterior wall of the eye. All these injuries may lead to permanent loss of vision. Sometimes it will lead to permanent loss of, while mouth injuries appear in the form of lip bruises or laceration. These lip bruises or laceration occur by blows to the face, which will make the lip sandwiched or crushed between the blow and the teeth inside the mouth. Another mouth lesion, which is very significant or very important in case of child abuse, is the torn frenulum. Torn frenulum occur either by tangential blow across the mouth, and sometimes it occurs because of forcing the feeding bottle between the lip and the gum. Torn frenulum is a significant or an important sign which may raise suspicion of child abuse. So we have finished the different types of child abuse. We have mentioned emotional abuse and neglect, sexual abuse, and physical abuse. And we have discussed physical abuse and mentioned what are the injuries in physical abuse. We have injuries in the skin, in the skeleton, in the head, in the viscera, and lastly in the mouth and arm. What or how to detect a case of child abuse? How can I diagnose a case of child abuse? This is our next goal. To diagnose a case of child abuse, we will examine the child in the ordinary form of examination, which is taking history, examination, then investigation, and we have differential diagnosis. What about the history in case of a child abuse is inconsistent with the type, character, and date of the injury. Sometimes the parents bring their child and say this child fall on the ground and develop this type of injury. But after examination, you detect that the injury is caused by burn, not due to fall on the ground and lead to bruise or otherwise what other injury caused by falling on the ground. So this is inconsistent with the type of injury. Sometimes they came and say that the child, okay, his injury is caused by his sibling bite him. But after you examine the injury, you find a longitudinal bruise or parallel lines of bruise, which is a characteristic of a slap mark. So there is inconsistency with the character. Sometimes they came and say this child developed this injury in the morning, and after examination, you find that this injury is in another in not in care developed in the morning because it have healing sign or the bruise have different colors which means that it occur days before. So all some in most cases the history in cases of child abuse are inconsistent with type, character, and date of the injury. The second problem in history is delay in reporting. Actually, when a parent, when parent have their child or children exposed to injuries, they hurry up to the doctor or to the hospital to examine him and to cure him. But in case of child abuse, they delay the reporting or going to the hospital until they find that they will lose their child if they continue not to go with him to the hospital. So always there is delay reporting in case of child abuse. And when you ask them about the explanation of the injuries, there is the changing explanation by the abuser, especially if there is more than one. If you ask them individually about the history or the explanation of the injuries which the child suffer, each one of them will give you a unique explanation or a different explanation. And if you search for records for previous injuries or previous visits of the child in this hospital, you will not find any records because they always go to a new healthcare facility, not to raise the suspicion that their children have injuries, different injuries or multiple injuries on different ages. So they change the healthcare facility to which they go with their children. So there will be no records about the previous injuries. Also, the denial is usually strong and is supported by both parents. They deny that they are responsible for these injuries. This is about the examination. The examination, we will take care of 2 points, the behavioral manifestation and, of course, the injuries. The behavioral manifestation, you can feel that the child feel fear from one parent or both. He avoid eye contact with his parents or even with the physician. Sometimes the child is too frightened to seek help and comfort and affection from strangers, from the nurse, from the doctor, and he feels frightened from his caregivers. Okay, this is the behavioral manifestation. The injuries, you should take care of the characters of injuries in case of child abuse. You should bear in mind that injuries in case of child abuse are different types of injuries in different parts of the body with different ages of healing, and they are multiple actually. Okay, this is about. What about the investigation? What do you suggest as an investigation in case of child abuse? What investigation do you suggest in case of child abuse? Hmm. What do you suggest? Actually, we will suggest investigation according to the case. Sometimes you, after the examination of the child, suspect that he will, this child has fractures. So you should make X-ray for him. Sometimes you suspect that the child has head injury, so you should send him to do CT or MRI to detect if there is any intracranial injuries. Sometimes you suspect that the child has sometimes you suspect that the child has injuries in the eye, so you should send him to do fundus examination or otherwise examination for his eyes. Sometimes you feel that you are not sure that if the injuries is due to abuse or not due to physical force or due to a disease. So you sometimes suggest investigation to exclude the disease which may lead to picture like being injured. Sometimes the child has hemophilia, which is a blood disease. This blood disease leads to easy bruisability. So you will find different bruises in the body of the child, and it is not due to physical force, but due to the disease which the child had. So you will do investigation to exclude hemophilia. So the investigation is dependent on each case separately. So this is the third category, is differential diagnosis. We have to differentiate child abuse from the following: from common murder, from accidental injuries, and from some pathological conditions. To differentiate child abuse from common murder, you should bear in mind that if child abuse led to death, it will be due to culmination of repeated injury, rather than being a single episode of deliberate killing. In case of child abuse, the child suffer from repeated injury. This repeated injury lead to sometimes will lead to bleeding or even a severe hematogenic shock, which will lead to death of this child. But in case of deliberate killing, there is a single episode of stabbing, shooting, strangulation. This is one episode of killing. But in case of child abuse, the death is due to culmination of repeated injury. Second, in case of child abuse, there is no weapons used, or the weapons are used very rarely. Usually, it is a manual force or manual violence, and even if instruments are used, they are instruments that not kill usually, like stick, like pelt. This is not killing an instrument, but in case of deliberate killing, the offender will use an instrument which kills usually, like gun, like knife, like any instrument that usually kills. This is the difference between common murder and death from child abuse. The first difference is it is caused by culmination of repeated injury, and the second difference is the manual force is usually used in case of child abuse rather than using weapons. To differentiate child abuse from accidental injury, we have to look for the site. As you can see in this diagram, on the left side, these are the site of the accidental bruising, and on the right side, these are the site for abusive bruising. As you can see on the left side, the accidental bruising occur in the T zone of the face, which is the forehead, the nose, and mouth. These are the area usually the child fall on them. On the back of the head, on the buttocks, and on the limbs, either the upper limb or lower limb. But in case of abuse, the bruising is in different sites on different parts of the body, not in the T-zone of the face, but it includes the eyes and cheeks, it includes the mouth and ears, it includes the back of the head, the neck, the abdomen, the back, the upper limb, and the lower limb in different parts. Okay, so the parts for abusive bruising is more than the areas or sites for accidental bruising, which is limited to the area on which the child usually falls. Also, to differentiate accidental scalds from abusive scalds, accidental scalds occurs usually when a child push a pot of hot liquid like kettle or any pot of hot liquid present on a table, and push it, and this liquid fall on him. So this will lead to scalds on his side of the face, on his upper limb, on his chest, and in the abdomen, and the severity of the burn will decrease while the fluid goes downward because it become colder. So this is the pattern of accidental scald. While in abusive scald, as we mentioned before, there will be scalds in the lower part of the body due to dipping of the buttocks and the legs inside the hot liquid, or sometimes the dipping occur by the hands and feet, so he will have glove and stocking pattern of scalds. The second differential diagnosis between accidental injuries and child abuse is by using the pattern. Usually, the pattern of injury in child abuse will reproduce the pattern of instrument used to make this abuse. Sometimes the bruise is caused by stick, sometimes caused by a whip, sometimes it's caused by pelt. These all these instruments can lead to reproducing its pattern of the of the pattern of its pattern on the skin, and the bruise will give us an idea about which instrument was used. Also, in case of burn, we can find as we said before, the hot iron can imprint its shape on the skin of the child in the form of the triangle, which is the front part of the iron. Sometimes the mother will heat a spoon or fork and put on the skin of the child. Also, the burn will reproduce this pattern. Sometimes it is caused by dipping the hands or feet or the legs or buttocks inside the skulls, and also sometimes caused by cigarettes, which leave characteristic pattern, which is reproducible, reproducing the shape of the cigarette, or raise a suspicion that this burn is caused by cigarettes. So these are the pattern in case of child abuse. While in accidental injuries, actually the injuries is usually due to falling on the ground, so you will find some abrasion and some contusion which cannot reproduce a pattern of an instrument. So this is the difference according to the pattern. The pattern in case of accidental abuse will reproduce, sorry, the pattern in case of child abuse will reproduce the causative instrument, while the pattern of injury in accidental abuse is vague. It cannot reproduce an instrument used to produce this injury. Differential diagnosis between accidental and child abuse injuries is by the number of injuries and their age. As we said before, in case of child abuse, the injuries are multiple injuries and their age are in different ages of healing. This is not the case in case of accidental injury. Usually, accidental injury occur once every few days. So you will find only one injury in case of accidental injury, while in case of child abuse, you will find multiple injuries. If you examine the whole body, you will find multiple injuries, and these injuries are in different parts of the body and in different ages of their healing. Second differential diagnosis, we have the differential diagnosed child abuse from common murder and from accidental injury. The third differential diagnosis is some pathological condition. Some pathological condition will lead to injuries which may raise suspicion of child abuse, but this is actually not the case. In case of calcium deficiency, or in case of some bone defects that like brittle bones, the bone are exposed to fracture easily. So multiple fracture will occur, and this may raise suspicion of being abused, this child being abused because of the multiple fracture. But here the fracture is caused by the disease in the bone or problem in the bone, disorder in the bone. Sometimes, as we said before, there is some blood diseases like hemophilia or other blood diseases that lead to bleeding, easy bleeding, or easy bleeding tendency. This bleeding tendency may lead that the child has easy bruisability, so you will find multiple bruises, and these bruises may be in different ages of healing. So this may raise suspicion of child abuse, but in this case, it is caused by the blood bleeding disorder in this child, not due to child abuse. Sometimes pigment anomalies and birthmark skin disorders may also be mistaken for child abuse, for bruising in child abuse, and so you should exclude all these anomalies. Sometimes the child has alopecia areata, which can be mistaken for hair pulling or an old turn on the scalp, which are manifestation of child abuse. But the cause is not due to child abuse, it is caused by alopecia areata, which is a dermatological disease. So we just have the last goal in our lecture, which is what should I do as a physician if I suspect the case of. First of all, you should bear in mind the possibility of child abuse. You should not be innocent during your examination of children, and you should always keep in mind that this child may be exposed to child abuse just be to be to detect this condition, and to keep the child, to keep the right of the child saved, because you detect this condition. If your examination raise your suspicion of child possibility of child abuse, you should document. What should you document? You should document everything, starting from the complaint by which the parents came and say to you, any explanation they give to you, and any change in explanation, you should also document them. And of course, you should document the injuries by all types of documentation. You should document them by diagrams, by photographs, if possible. This will be very good. You should document the nature of the injury, the size, the position, and the age of healing of this injury. If there is sample you should collect them properly. And last, you should write good report and report the case to the authorities, which is responsible for these types of crimes, to save the child from being exposed to abuse later on, and to save his rights to be get away from the source of being abused, even this source is his parents. So we have finished our goals. We have discussed today what is child abuse, what are the risk factors of child abuse, what are the different types of child abuse, how to detect a case of child abuse, and what should I do if I suspect a case of child abuse as a physician. Now it's time to think. Here is the questions. What are the most common injuries in child abuse? Physical injuries, head injuries, skin injuries, and or eye injuries. What is the most common cause of death in child abuse? Physical injury, head injury, skin injury, or eye injury. What is the most common skin injury in child abuse? Laceration, abrasions, bruises, or cut wounds. Which one of the following bruises is caused by an adult gripping a child? Pinch marks, knuckle punches, fingertip discoid bruises, or slap marks? Which one of the following is a character of healed cigarette burns? They are pink or red in color. They are silvery with narrow red rim. They are circular or triangular, P and C. In what type of child abuse contusions is present? Physical abuse, emotional abuse, sexual abuse, and C. Which type of intracranial hemorrhage occurs frequently in child abuse? Extradural hemorrhage, subdural hemorrhage, subarachnoid hemorrhage, or intracerebral hemorrhage? What is the mechanism of occurrence of spiral fracture of the humerus, falling on the stretched upper limb, being hit by a stick on the upper limb, twisting of upper limb? Give the scientific term. A form of child maltreatment usually induced by caregivers. A butterfly-shaped bruise with one wing larger than the other. Put true or false and correct the false. Most injuries in child abuse are single and fatal. Multiple examination in sexual child abuse must be avoided. Try to find the answer for this question, and if any question is not clear, please contact me. Thank you for your listening, and goodbye.